The fact that every baby in the nursery can have a murmur raises a particular question. There you are in the nursery and you hear a murmur on newborn, and you have to make the decision whether or not it's the 499 out of 500 children who have a PDA, that's a normal physiologic thing that's going to go away, or that group we talked about, 2 out of 1,000 or 1 in 500 children who have critical congenital heart disease. So how are we going to decide with this baby who has a murmur whether or not he is the 1 in 500 or the 499 in 500? Well, what we usually get is we get a series of tests. We usually get an X-ray to look at the heart size and the pulmonary blood flow. We get an electrocardiogram. We usually ask for 4 extremity blood pressures. We ask for pre and post-duct saturations. And what we sometimes get is an echocardiogram. So let's look at these and see how well they work. Let's look at the X-ray first. How good is the X-ray in picking out this 1 in 500 from the 499 out of 500 that are normal? Well, most studies suggest the sensitivity specificity in the range of 60%, which is not bad, but I don't think it's good enough to stake a child's life on. EKG, also in the range of 60% or so. Again, okay, but not terrific. 4 extremity blood pressures, this is my favorite because I think this we always ask them to do this. It's a little hard to do. The babies are swinging around. I think this is useless. I think this picks up 0% of these kids. In the first place, we're looking for coarctation of the aorta. And coarctation only occurs in 1 in every 10 or 12,000 births. So we're going to miss most of the 1 in 500 anyway. But even in that group, if the ductus is open, I don't think you're going to have much of a blood pressure difference anyway. So even if the baby has critical congenital heart disease, if he doesn't look sick, the ductus is probably open and you're not going to get any difference in blood pressures. Let me go to the echo. Now here's a test we can all love. The echo is probably 99+% accurate. This is very effective at picking up heart disease, but not very cost effective and not available to many hospitals where they don't have an echocardiographer right on call who can look at all this stuff. So I think it's unnecessary to do this on every baby.